biopsy-proven adenocarcinoma. Tumor is at GE junction going up to the lesser curvature. We are doing EUS for T staging.
उनको भी लिखा ठीक है लिखा
If I can identify all the objects on the EUS, great. I'm a great EUS guy. Actually, you don't make any difference to the patient. But if I miss a major thing, like Riaz is saying, pancreatic cancer, I don't know what are the important structures around that I need to find. If I can do that, I'm as good as anybody else who can tell you everything. So, पहले आप अपने आप को अच्छा बेसिक कर लेना, उसके बाद फिर आप BSc भी करें, MSc भी करें, PhD भी करें, और फिर अपनी किताब भी लिखते हैं, that's a different thing. But पहले basics तो correct हो जाए. And I was just going to say there is another approach to it. Because EUS has become more therapeutic, or maybe FNA based now. And the therapy hटा दें, the people who are really interested in biopsies, they will just go straight to the pancreatic head, take the biopsy of the pancreas out. Because staging, as Khalid just showed you, is actually going down and down because your MR, CT are going to get better and better. And the chances are that EUS may not have much of a role except for vascular invasion in certain parts. Otherwise, even vascular, SMA, SME, you see is better. Then you
मुझे ग्लव्स दे दो
so you're down to portal vein ring. And portal vein surgeons tell you, really good surgeons, doesn't make any difference. It's nice to know, but I don't think that it's a patient. You don't exclude the patient now internationally. So SMA का main issue है. Down to FNA and therapeutic.
Wait, check the balloon. There's no air in there, right? थोड़ा inflate करें, नीचे रख के. There is a air, हाँ? नहीं ठीक है. Okay. So how we put it down and like this way, तो air जो है ना that comes up and then हाँ सही ठीक. No, it's हाँ just facing down. हाँ. And on the back side, yep, that's good. ठीक.
Civil recording is.
Right.
So usually what I do is like, can you hear me?
Yes, we can hear you.
So for these G junction or any type of cancers, here you can see a nice endoscopic view too, but most of the time I do a EGD examination first, and then we'll go with the EUS, because you want to see how structured it is, and are you going to be easily able to pass the scope, or it's going to be a struggle. And but it's going in easily, nicely, no problem. So
Waqar,
thanks to my
Waqar, you are going to be charged extra for this, you know that.
For keeping my mouth shut as well.
So that's very expensive tumor, looks like, huh? Yeah, it's a quite expensive tumor. And so we will, what we'll do is like, we can come back to the same G junction area, we can start there. So air is the enemy of ultrasound, so as soon as we get to the area where we need to start, we'll suction all the air out. So this is good right here. यहीं पे कर लें मैंने कहा, okay. So right here.
40.
Okay, हाँ जी, थोड़ा सा अंदर चले जाए तो, okay, right there. This is good right there. So section. So here, थोड़ा सा balloon कर लें. Because we usually we are using a linear scope for staging, so we have to bring the mass in one area. I think this is good right there.
Right.
Yeah, right there.
Suction over. I'll just
थोड़ा सा,
make sure
yeah.
your suction is done.
So when you use a linear scope, you have to make sure that you are not. Actually, that was a good view, right? Right here, you एक जगह इसको पहुंचा के balloon कर लें. हाँ जी. Okay, just big wheel towards you, right there. Okay. So here I will freeze the image a little bit. You can see the tumor right here, but there is no wall layer distinction. So it's involving all the wall layers at least. And looks like there may be a lymph node here as well, but we'll take another look at that area. So this is, I don't see any wall distinction. I don't see a muscularis. We need to do maybe a little bit better view, but this looks like it's going to be at least T3, and then we'll go from there. Okay, let's see.
Right.
Okay.
Shall
Can
we
we
come
get
back on?
go in a little bit? No, just come back a little bit so we stay in the yeah. Big wheel towards you. Big wheel towards you. And big wheel to suction all the air out and pull it. Pull the scope back a little bit while maintaining the contact with the wall. That's good. Keep coming back. Big wheel towards you. So that maintains the contact. Big wheel towards you will maintain a contact with the wall. So here you see a nice lymph node right there.
Yeah.
And so that's a very malignant appearing lymph node right
yeah,
there.
I was just going to take Khalid. Can you just go through the features that suggest that lymph node is malignant?
So when a lymph node looks very regular and hypo, or to hypoechoic, which is the black one, then yeah, size obviously is considered, but size is more important are the other two features: shape of the lymph node and echogenicity of the lymph node. Here it's a very well demarcated round lymph node, which is a hypoechoic. It's in close proximity to the tumor. This is a very malignant appearing tumor. If it has a very irregular surface, I mean the edges, and it is isoechoic, then usually it's non-inflammatory. So, but this one looks more like a malignant lymph node. Throw yeah, come out, yeah, right here. And can you put a little bit, yeah, right there, you pull back a little bit, try to maintain this right here. Okay. You can always go back, scroll back whenever you need to. And I think this is also a part of the lymph node right here. And the gastric wall, the tumor is this one, but we really don't see any muscularis, intact muscularis there. And you see a part of the serosa, so it's kind of going, involving complete muscularis. So it's at least T3, I think at least we have seen, and this may be a same lymph node.
Right.
Is it same lymph node? I think. Yeah.
Shall we forward, back up?
So now we know that it's a T3 lesion, tumor at least. Let's go to the G junction and try to find the aorta from there. Okay.
Right.
So just like a regular EUS, which you are going to do. Okay.
Right, so that's the G junction, yeah?
Okay. So what we'll do is like this way, and come back, and that's the esophagus. We will go into the stomach, and when you get into the stomach, can you inflate it a little bit? I want to show you something. Are you up chilling in a stomach? Can you come back? Can you inflate the stomach a little bit? Come back a little bit with the scope, close to, okay. Yeah, inflate it. I just want to show you.
Yeah.
So we need to, if we come back close to the GE junction, which was close to right here, if you look at the scope, it's let's go like 4 or 5 centimeter in. Big wheel towards you. Suction the air. You see the left lobe of the liver?
Yes. Oh, yes.
Okay, so you go in to the stomach 4-5 centimeter
Yeah.
below the G junction,
Right, okay.
suction the air, big wheel towards you. You are seeing the other part of the left lobe of the liver. So, and anybody appreciates the tumor itself here?
Yeah.
This is a tumor right here. This is the liver capsule. It's touching the liver capsule, and we see some ascites here as well.
Yeah.
So here, this is all tumor. This is a very nicely demonstrated right there, the tumor. We will pull the scope back while maintaining the big wheel towards you a little bit. Release the wheel a little bit so scope can move. And there is a ascites, so it's more than T3 actually. Rotate the scope to the right. So, yeah. So here, right there. Now pull it back. Release the wheel, release. Okay, stay there. Big wheel towards you, please. Big wheel towards you. You see the left lobe of the liver. From here, if you are in this position, right there. Okay. Now big wheel towards you. We need to find the left lobe of the liver. Let's start. Do it again. One more time. That's we are right. We are way up now. So we can do endoscopically. Okay. Okay. Come back. इसको थोड़ा सा ना ऐसे. So come back a little bit. So let's find the left lobe of the liver again. Big wheel towards you. Right there is the liver. Okay.
इसको rotate करें.
And right there. ठीक? Right there. Okay. Pull the scope back. Now right, stay there, and now rotate further. Keep rotating. The scope is not rotating. That's why. Okay. Keep going. Keep going. Keep going. Big wheel towards you. Yeah. It's way too much right now. You see that? If it shouldn't be like that, it should be comfortable. So we have to start. The scope wasn't moving initially. So right there. Yeah. Keep going. Scope still not moving properly because it's not rotating. Now we need to find the aorta. That's what I'm trying to see. No, there's no. That's a part of the liver. Yeah. So that's a lymph node right there.
Right, okay.
And still we need to find the aorta.
Right.
Yeah. So, but that's a way too much. Should not have to do that much. Okay. But come back a little bit. Come back with the scope. Come back. Come back. Come back. Come back. Okay. So if you rotate to the right. Right there. Yeah, there, you found the aorta right now. You see the aorta? Big wheel towards you a little bit. So aorta position should be, yeah, just maintain that. Yeah, you can go right there, okay? So big wheel towards you a little bit. So when you find the aorta should be in like a nice landing position of the plane. It shouldn't be completely flat. It shouldn't be like up and going up and down. It should be like laying in this position. So it's kind of a landing down there. Okay. So from here, and rotate a little bit to the right or the left. We don't see the celiac yet. So we advance the scope a little bit. And now do it again. Same thing. Yeah, there you see it. Okay. You see the celiac right now. And you see the SMA underneath. Okay. And you see the celiac. Release the wheel, just release the scope on nice, not too much torque. Big wheel towards you a little bit. Okay, gently advance the scope and rotate it. You see that? Let's follow the celiac. Now release the big wheel while gently advancing the scope. Release the big wheel. Yeah, because it's torquing quite a bit. It may be because of the tumor as well. And so we kind of lost that. We need to bring that back because we don't see any pancreas. Okay, this is a SMA right there underneath. Release the wheel further. Release. Big wheel away from you. Big wheel away from you. Big wheel. Oh, okay. So I think this may, I don't know if it's a pancreas. It's still a part of the tumor. So this. Okay. Release the wheel a little bit more. This looks like maybe a part of the tumor, I think. Okay. Just let me just see if I can find the pancreas, and then I'll see how we found it, if I can.
How?
I'm gonna try to see if we can easily find the pancreas, because there's a lot of tumor there, as you see,
Yeah, we.
and
So-
you don't want to do too much.
Khalid, how much time do you spend looking at the liver for meds in patients where you're suspecting?
Or
or possi-
if I am there, like I at least spend for 3 to 5 minutes there. Okay.
Okay.
Yeah, especially with the liver tumor like this. So here, scope, वो neutral position में, ठीक है? We are right below the G junction. I'm looking at the other end of the
Right, okay.
and big wheel towards me. You see the liver came up
Right, okay.
right there. Liver say, and then we rotate it to the right to get to the aorta. Right there is the aorta.
Acha, Khalid, do you normally assist the rotation with your hand as well?
No, yeah, like ये जो है ना, yeah, it's yeah, you can especially here when you can assist that with your hand.
Acha, ठीक.
Okay. So here you see the celiac is coming right in front of the aorta right there.
Yeah.
So it may be because of that. Really, I think it's that tumor is taking over.
I thought we just saw the pancreas here.
Yeah, it's not very.
Yeah, but
A portion of it is a tumor actually.
There.
Yeah, right
That's,
there.
those
it
the
is.
vessels there.
Yeah.
The splenic
Right,
artery
right
vein.
there. Yeah,
that's
right now. So this is a splenic artery. This is a splenic vein right there.
Alright.
But there is a tumor right on top of that. You see that? That's a gastric wall.
Right, okay.
This is a tumor, and this is a pancreas.
Acha, how can you tell the difference between the splenic artery and the vein?
Yeah. So splenic artery is always going to be on the top,
Okay.
and splenic vein is makes the bed of the pancreas. And also, if you really want to do, you can put a Doppler on that and confirm that. So this is a vein, and I just want to show how the venous flow is and arterial flow is going to look like. You see the venous, it's a flat kind of line, okay?
Right, okay.
So if I put that here,
Oh yes, yeah. So how
So-
do you move the cursor? On?
yeah, so this is like get rid of the cursor. That's cursor is not there. You have to get rid of that. Then you turn the power Doppler on.
Yeah.
Power Doppler on. There should be 2 screens.
Yeah.
After that, you have to go to this screen and hit the PW start power. Otherwise, it's not going to record.
Right.
Okay.
Right. Okay.
Right there. You have to hit that. Okay. So we'll go back to B mode. So that's a way like you see the pancreas right there, but the tumor is right above that. So let's find the pancreas same way pancreas and
Okay,
yeah. तो वही liver पे जाके
We,
हाँ जी दोबारा नए सिरे से मनोवर पूरा करें. Yeah, right there. You see this nice movement. So you see the splenic artery right there. You see the splenic vein there.
Yeah.
This is all the tumor we just saw, and this is the pancreas. This is the muscularis.
Right,
You see that if you follow back that towards, I'm just going to do something. Pull the scope back a little bit, and you start losing the muscularis because the
Right.
tumor is right there, infiltrating right through
okay.
that. So it's here we see again, but this one is being infiltrated. So splenic artery, splenic vein, gently advance. Now you are right onto the pancreas. This may be a small duct right here. So just keep that under. This needs to come a little bit underneath the transducer. Big wheel towards you. Big wheel towards you. You see that how it moves to that way?
yeah.
From here, now rotate the scope to the right. This is pancreas.
Yeah.
Keep this in view. Keep coming. Pull the scope out a little bit, right there. No, now gently advance the scope. So this hole is the pancreas right there. So keep rotating to the right. Okay, if it moves this way, that means you need to pull it back. Okay, if it moves that way, you need to push the scope in there. So keep rotating. You see that
How
kidney,
is the basic
kidney.
question? If I'm rotating toward the right, what side of his anatomy am I going towards?
Usually you go to the left of the patient.
So I'm going
So
towards
right.
the spleen.
So yeah, you are going towards the spleen.
Okay.
Okay. So,
Okay.
so here this is still a portion of the pancreas. Pull it back. You see that left kidney right now? Right now, this is a left kidney. This is a tail of the pancreas. If you pull the scope back a little bit more, pull the scope back, release the wheel a little bit, big wheel, and pull the scope further back, further back, further back, back. Keep it, pull it out, pull it out, pull it out, and rotate it to the right. Pull it out, okay, and rotate to the right.
That is the
Yeah, right there. That's a spleen right there. Spleen. So you have to rotate it to from the kidney. Yeah, nice. There is it. Okay. Now go back a little bit. Opposite. Keep going. Keep going.
that's
Left kidney.
acha, good.
Okay. Splenic hilum.
Right.
Okay.
Acha, that's
This is a
why-
pancreas.
pancreas.
Okay. From here, just keep it there. Keep rotating to the left. Keep rotating. Big wheel towards you. Big wheel towards. You still have a pancreas nicely. Okay. So it's trying to move this way. So pull it back a little bit. Now keep rotating to the left. Left torque. Left torque. And here the pancreas. We don't go back a little bit this way. Right there. So here is the yeah, no. That's a splenic vein. Keep it.
Conference.
Yeah, confluence is right underneath here. So this is meeting with the SMV right there and confluence here. So this is the pancreas. So that's good. Okay. ठीक. So let's add this pancreas right there. Tumor is there in the wall. You see both actually.
you see
Yeah,
both?
yeah, the tumor you see right there.
Yes.
Pancreas underneath. Okay. So let's go to the duodenal bulb now.
That's under endoscopic view.
But absolutely. Tumor है ना इसलिए yeah. So maybe pull back first, yeah, and then get idea, yeah, बिल्कुल. Because it's hung up on the tumor, तो थोड़ा सा बेशक कर, yeah,
You are traumatized, you will follow.
yeah. Good. No, this is just a yeah. It's on that side. It's a lot of tumor. Right there, good. Okay, so we go into the, yeah, take a look at the duodenal bulb. Okay, right there, no, yeah, not too much. We have to go to the duodenal apex, okay? And we cannot reduce the scope. It has to stay in the long position, right there, okay? So that's the kind of left upper corner of the duodenal apex. Okay, get the transducer on there, right there. Okay, big wheel towards you now. Okay, suction. And you get the left lobe, you get the liver. So, and you get the portal vein on top of that too. So you need to rotate to the right and pull the scope back because you are way too in there, okay? Keep pulling back, keep pulling back. Yeah, big wheel towards you now. Okay, all the way. To the middle.
Earphone on the corner.
No, yeah, I think it's, yeah. So here, this is a portal vein. We just need to get to the. This may be a duct right here. I don't see a flow in there. You see that underneath? That's a duct by probably. Keep rotating to the right. Keep rotating. Keep rotating. So this is too much movement, but it's not being transmitted towards the transducer. Transducer is not moving at all. इधर से ये नंबर उधर का उधर ही पड़ा हुआ है. आपकी movement जो है ना वो सिर्फ यहाँ तक रह रही है. It's not going beyond that. हाँ, now it is. But that's a way too much torquing. It should not require that much torquing. So this is a portion of a pancreas right here. This is a portal vein.
Right.
But pull it back a scope a little bit maybe. That's
the
one of the ducts,
Acha.
and I think it's a bile duct. Yeah.
Acha, ठीक है.
Uh-huh.
Because the bile duct will be closer to it. then.
Yeah, closer to the transducer.
ठीक है.
But there may be some varices as well. Looks like.
That's portal vein there, yeah?
And that no, that's we are
Meaning
looking at the
meaning-
aorta. This is a vein.
wait,
Where we are a little bit far in there because you see the IVC right
You
there.
want me to come back again?
Yeah, maybe. Yeah, take another look. But it has to stay in long position for to have a good. Because when you pull the scope back, yeah, right there. Okay, big wheel towards you now. So gallbladder is on the top.
So that's called right
हाँ
on
जी
the left side.
okay.
इसमें shall I inflate the balloon? Can you just move it?
Bile duct यहाँ पे वो portal vein, bile duct, gallbladder. हाँ जी. You just need to move it in a way, rotate to the right, rotate to the right. Yeah, it's going upwards, but it needs to be here somehow. Release the wheel, release big wheel of it. Yeah, now it's starting to come down a little bit, but still it's not in the ideal position.
Then I just inflate the balloon.
Uh,
45 balloon.
Okay. It may be a anatomy issue because of the tumor. Let me see if it's, that's the issue.
ये आपने अभी क्या ये काम क्या शुरू कर दिया?
क्या?
अच्छे बच्चे आप ये सीटियाँ खा रहे हैं।
वो मेरी किस्मत ही देखी कि पहला केस जैसे जबरदस्त मिला तो
Bile duct is right there. That's what you are getting. हाँ जी, बिल्कुल. Tumor is completely infiltrating everything, so that changes the anatomy. So it's not going to be the way we. Yeah, that's answer right there. हाँ जी, ये वही है प्रॉब्लम ये है कि ट्यूमर इन्फिल्ट्रेशन बहुत ज़्यादा है. नहीं, आपका कसूर नहीं है.
ये बॉल के साथ लगाए ना ये।
हाँ, yeah, it's all around.
बॉल के साथ लगाए।
अब ठीक है
हाँ, ठीक है. थोड़ा सा go inside. Okay, right there. वही वाला. Same we get it. So I guess that's fine. We can do the mediastinum actually. हाँ, आ जाए वापस.
अच्छा हो
हाँ
गया
जी,
ये
हाँ जी.
अरे कैसे
ठीक है.
मत बचू ठीक ठाक किया
इसको जो है ना स्कोप को स्ट्रेट. So up to 30 if you छोड़ दो. अगर आप 30 तक आएंगे ना तो you see the left atrium.
yes, yeah, that's
Big wheel towards you now. ठीक है. जब left atrium नजर आता है तो big wheel towards you. And left atrium needs to come in this corner and that's yeah. नहीं ज़्यादा rotate करने की बिल्कुल ही ज़रूरत नहीं है. Actually neutral position में होगा ना उसको.
अच्छा ठीक ऐसे ऐसे करना है तो मेरी आदत करूँगा अच्छा ठीक है
Okay, pull it back a little. आप थोड़ा सा rotate करें.
वो कर दूँ
नहीं, एयर की ज़रूरत नहीं है. रोटेट द स्कोप तो या राइट पे.
अच्छा ठीक है
ठीक है. तो अब ये लेफ्ट एट्रियम आ गया ना और पल्मोनरी आर्टरी यहाँ पे, तो ये सब क्राइना आ गया.
अच्छा ये सब कराना चाहिए
ठीक है. हाँ जी. बिग व्हील टुवर्ड्स यू. ठीक. हाँ. यस सर. थोड़ा सा एंड थोड़ा सा रोटेट करें स्कोप को. इसका व्यू लेफ्ट एट्रियम का बेहतर. अदर वे. सो एक तरफ नहीं हो रहा तो दूसरी तरफ जाना पड़ेगा ना. सो यू सी द माइट्रल वाल्व राइट देयर. ये वाला.
अच्छा वेरी गुड
एक मिनट है. ये देखें.
अच्छा मतलब
ये लेफ्ट एट्रियल अपेंडिजेस है जहाँ पे वेजिटेशन होती है. फ्रॉम हियर नाउ लुक डाउन विद द स्कोप.
अच्छा
Yeah, until the aorta comes, you see that? Pull the scope back, keep the aorta in view, pull the scope back. ठीक है. जब ये अभी भी है aortic arch, ठीक है. So जब aortic arch जो है, this is gonna come right here. Now big wheel towards you, big wheel, and big wheel towards you a little bit, and just gently rotate. And there you go, beautiful view of the AP window. Aorta, pulmonary artery, AP window.
अच्छा एक मिनट ये होता अच्छा यहाँ पे लाए हैं ना
हाँ नहीं थोड़ा सा
नहीं
वापस.
तो मैं इसको
हाँ
दोबारा वो कर रहा हूँ
बिल्कुल.
अच्छा ये इसके बियॉन्ड क्या स्ट्रक्चर है ये जो
दिस इज अ प्लूरा और लंग. ये सारे शैडो लंग का एयर का. हाँ जी. और देयर इज अ पल्मोनरी एपी. बिल्कुल.
ये भी लिम्फ नोड्स के लिए जरूरी है
हाँ जी. ये स्पेशली लंग कैंसर वाला. ठीक है. हाँ जी. ज़बरदस्त.
है